This is an important point because non-operative management, it's really important for patients. It is absolutely central in rectal cancer, where a surgery can have really severe impact on quality of life of patients. For colon cancer is a little bit different because normally surgery is related with less complication, but however is something to be explored. What we saw in our study was that we didn't have a precise concordance between clinical and pathological response, which means that we were unable to predict a pathological complete response with clinical evaluation. So the sensitivity was around 20%. This means that we are not capable exactly to identify patients who are in pathological complete response and that could undergo to non-operative management safely. So one important point is that we need to do better staging of patients, both baseline, both at re-evaluation, probably with implementation of imaging techniques, but also with biomarkers like ctDNA or other translational biomarkers. And for toxicity, we saw that doublet ICI was associated with higher rate of complete response. So if we aim to reach non-operative management, maybe doublet ACI is more efficient, but it's more toxic. So the discussion between the different treatment regimens should be done really in a multidisciplinary setting and with the patient also, and based also on the patient conditions and comorbidities, and so to have a global look of the situation and decide case by case.